Welcome back. Checks on COVID-19 vaccination centers are continuing across the country, this time in the northwest. Maseko Ratlacha is following this story for us. She's in Klerksdorp. So Maseko, the Deputy Minister in the Presidency and the Health MEC checking things out today. Any problems spotted?
Well, Shahan, not necessarily any problems that were spotted here in the northwest. We are at the Klerksdorp Tertiary Hospital in the northwest, and what the MEC was telling us earlier, Shahan, is that the challenge in the northwest is reaching the healthcare workers who are in rural areas. As you know, healthcare workers are supposed to register on the internet in order to get an electronic voucher before they are able to get inoculated. So he said that that is a challenge, but they're trying their best as the health department in the province to sort that out. And another challenge, of course, Shahan, that the MEC told us about is the fact that the Northwest Province, you might have noticed, is lately registering or bringing the number of deaths happening in the Northwest are higher on a daily basis. They're not necessarily high when you look at each province in totality, but in terms of the death rate each day, they are recording a high number. And he says that issue is because people are trying to heal from home, and his plea is that they come to hospital so that they can get healed in the hospital and not stay at home and end up coming to the hospital when the COVID-19 pandemic is, has already wreaked havoc in the immune system. But I am, Shahan, at the Aurum Institute where, the vaccines are actually being stored here in the northwest, and I'm going to be bringing in the managing director, Tanya Nielson, to speak to us about what it is that the team is doing here in terms of the storage of the vaccine.
Good afternoon, and thank you very much. The Aurum Institute is the research facility supporting Sisonke vaccine rollout in the northwest. We have two sites in the northwest, one located in Klerksdorp and one located in Rustenburg. In Klerksdorp, we have been supporting the Klerksdorp and Sisonke complex by providing vaccines as well as being the custodians of the vaccines. And in Bojanala, we have been supporting JST, Moses Kotane, as well as Pegler-Ray hospitals. Outside the Dr. KK district, we have also been supporting Maikeng to provide and prepare vaccine doses. So here you can see our vaccine preparation team. Once we receive the doses, we are the custodians. We are responsible for managing cold chain and for managing accountability. And once we receive, we need to ensure that the vaccines are stored at appropriate temperatures, initially in the freezer, and then moved to the fridge, then prepared, stored in cooler boxes and taken over to the vaccination facilities. So the syringes are taken over, it's clearly marked with the expiry time, and the expiry time differs depending on whether you keep it in the fridge or at room temperature. 6 hours if it's kept in the fridge, and 2 hours if kept at room temperature. So we need to ensure that the cold chain is maintained and that every syringe is accounted for.
All right, Tanya, tell us some of the challenges that you've been facing in terms of the vaccine and how it's stored. You know, there's been a lot of debate in terms of the expiry date, a lot of people concerned around that.
Yeah. So I think logistically, the Janssen vaccine is a bit easier to manage because, one, it can be stored in the fridge, and secondly, it's only one dose. But there are still some logistical challenges in terms of maintaining cold chain. The expiry time is longer if it's kept in the freezer, and not all the vaccination sites are equipped with these reliable freezers. Most of the vaccination sites do have fridges, and that's been useful in maintaining a longer cold chain. But once, as I mentioned, once it's prepared in the syringes, you only have that short window of time. So you need to make sure that the demand and the supply evens out so that you don't prepare too many syringes, resulting in loss of syringes due to expiry. But you also need to make sure that we keep enough syringes to keep the road flowing so that we don't have a lot of people piled up together, increasing the risk of spread of COVID.
Thank you very much, Tanya. I'm just going to bring in Shahan, one of the people who are actually spearheading this project here in the Northwest. He's from the Sisonke study. His name is Dr. Ines. Thank you very much, Dr. Ines, for your time. Now, I was telling you earlier that some doctors and frontline workers are saying that sometimes they register on that online service. They get to that certain hospital where they are told to go, and then once they're there, they're told, oh, we've already inoculated enough for the day, we've reached our quota. Why does this happen? Can you explain to us why the quota and what those healthcare workers need to do when they're turned away?
Thank you very much. Good day, everyone. Yes, so the system is designed, the online system is designed with a scheduling system in it, and it schedules a certain amount of participants or patients per day to come for an inoculation. And this is to ensure that we don't get overcrowding of the facility, and which could create a situation, where with crowding we could get spreading COVID, and we would hate that to happen when we're trying to protect healthcare workers by vaccinating them, and then finding that we are actually, then creating a situation where COVID could spread. So it's very important that we make sure, that the social distancing and the masks and all of those things happen, and there's not too much crowding in the facilities. So generally, if a person can't get vaccinated on one day, the system will move them over to the next day, and they'll be able to get the vaccination the next day. So I hope that answers your question.
So you are the person who is leading the investigations around how the inoculation is going in some parts of the Northwest, I believe Klerksdorp as well as Mahikeng. How are things looking there overall in terms of inoculation? I know the Northwest has almost inoculated 10,000 healthcare workers.
Yes. So in the Northwest, I think we would have reached 10,000 today, which I think is a great achievement. And I must really commend our Department of Health colleagues and the private sector colleagues, for the great teamwork that we've been able to be a part of. And so I think it's really been going well. And, we are hoping to, once we've covered certain areas, to reach out to other areas in the province to make sure that as many healthcare workers as possible around the province can get their vaccination.
Right. Thank you very much, Dr. Inez. So now, Shahan, that's it from myself here in the Northwest. It is quite chilly where we are. Obviously, it's where the vaccine is being kept to the correct temperature.
Yeah, I see 2 red cooler boxes there to the right of you. I wonder if they're in those boxes. I hope not. eNCA